Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on anything you'd like to talk about your health. You've had a problem, you've tried, you've applied, you've put direction in that doesn't work. Well, here's your opportunity. Give us a call. Love to talk to you. We have a very special guest and a very special program today, and one I think that is going to be extremely interesting to the women in the audience. And what we're going to talk about is an alternative to detecting all kinds of things that can happen to breast tissue. We're talking about thermographic imaging. And, most of you ladies are told to go out and do mammography and things that, in my opinion, can be extremely damaging and invasive to your body. And the false positive, false negatives on them are significant. And so why would we do that? Well, we may get into that later on. But having said that, I'd like to introduce someone who has been with the Roselle Center for Healing and Thermography Centers of Fairfax for a long time. And many of you know her. Many of you heard her lecture before. Derreth Painter. Welcome, Derreth.
Hi.
Hi. I'm glad that you're here. Getting you in studio sometimes is like pulling teeth, but you made it again.
It is, and I did make it again, absolutely.
It's going to be fun. No, we're talking about the advantages of thermographic imaging as it relates to detecting breast problems, and whether it's a tumor formation or the potentiality of cancer down the road or things of that nature. And this coming Wednesday evening, October the 2nd at 7 p.m. at the Roselle Center for Healing in Fairfax, that's going to be the topic, and Derreth will be your presenter. So here's an opportunity to really learn from one of the best in the business. Derreth, you've been in thermographic imaging for how many years now?
I would have to, I'm thinking about a 10-year, we're going beyond that 10-year mark now.
Yeah, you're over that.
I think so, yeah.
Yeah, time flies when you're having fun. Absolutely.
Exactly.
So, let's start out by simply saying and describing what thermography really is. I mean, there's a lot of people out there saying, thermo what?
Yes.
And what is it? And, how is this adaptable to this, in a medical arena that is perpetuating something that I think is more damaging than it is diagnostic. But what's thermography?
Sure.
We'll get into the rest of it later.
So first of all, thermography is simply recording the body's infrared heat. Very simple. That's all it is we're using a camera that's been specifically designed to look at heat and constriction. Oftentimes people will sit there and say, well, it's only heat, but we're also looking at constriction within the body to establish, any anomalies or asymmetries that are going on within the system to identify, or at least begin to identify, either pathology, disease, pain, helps visualize pain where other, diagnostics aren't able to do that. So there's nothing other than recording of the body's own heat and constriction.
So, I've been around what you do now for
a while,
a whole lot of years. And so let's talk about what really, we're talking about looking at a body's heat index, which is really its blood supply, its circulatory pattern.
Right. And Dr. Pina will tell you it's body Doppler. I had to throw that in there.
If you didn't do that, she'd get angry with you.
Yeah, exactly.
So, the real terminology is digital infrared thermography, right?
Yes.
And so the images
Thermographic imaging, yes. It's DITI, for those who are looking it up on the web.
DITI. And so when we're looking at that, you're looking at vascular circulation. So let's stay with the breast tissue for
and
now.
Metabolic changes. So yes, blood flow and metabolic changes.
Both heat signals.
Yes.
Both heat index.
Yes.
So in all situations of pathology, there has to be a shift and change in tissue. And that shift and change in tissue increases its metabolic rate.
Yes, because of blood flow.
And because of the blood supply. Mm-hmm. So how does thermography register this? Why is it that it's so cutting edge compared to doing other types of investigative type of procedures?
Well, it's different than the other, types of testing that we typically do. We're going to leave this focused on the breast area. So what thermography is actually doing, it's looking at breast tissue symmetry between the two breasts. It's also looking to see whether or not there is any outside blood flow that occurs that is not within that woman's normal, and trying to establish, is it static or is it progressively getting bigger and more, within the breast tissue, moving through the breast tissue. So it's looking at changes over time. That's what we call in thermography angiogenesis. We're looking for that pathological process that is separate from the normal vascular aspect within the breast tissue.
So angio meaning blood vessels, blood supply, genesis, the creation of that blood supply.
Creation and continuing, yes.
So what comes first, the chicken or the egg? So you have a breast tumor, all right? And whether it's ductal or it's invasive. And this tumor most often
has to have a feeder.
Has to have a feeder.
So the thermography is actually looking for the feeder. It's not looking for the hard component. That's one thing that thermography cannot do, is to look for hard components. And that's the biggest difference that I educate women on when they come in to do breast thermography. Is unlike the mammogram, we're not looking for the hard component. We're looking for what grew that hard component. So that's that feeder aspect, that angiogenesis. And in the case of inflammatory breast cancer, there is actually no tumor. So thermography is right now, as far as I'm aware, the only technique that is able to identify the angiogenesis without a hard component or that tumor.
So what comes first, the tumor or the blood supply?
Blood supply.
So what you're saying is that this blood supply that starts developing over time is the prelude, if you will, to the formation of the tumor. So if you can see the blood supply early on,
you have a higher chance of survivability if you have early detection. And that's the key with thermography, is if you can find that suspicious activity that's occurring early on. And with thermography, we say within about 5 to 8 years before a tumor actually is evident within a moment.
That long?
Yes.
So a woman who goes to her doc and finds a lump or a bump in her breast or something.
She's had that in there for quite some time.
And so what you're saying with thermographic imaging, this blood supply, this feeder, if you will, to that tumor before the tumor forms, can be detected early on. And so subsequently, and I'm extrapolating, we're going to talk about it a little bit in the second half of the program.
Let me clarify. That's on an active cancer, and that's the key. If it's a dormant cancer, that's very difficult for us to see. But 90% of what we find is active cancer. And of course, we tell women, you've got to make sure that you confirm that with other testing as well.
So you're talking about a procedure that has a 90+% accuracy rate in detection.
Yeah.
Okay. Opposed to mammographic imaging, and you can all look this up if you'd like to, is between false positives and false negatives, you're looking at a 20% problem.
Yeah, it depends on which source of information you're looking at, but yes.
Yeah, I mean, and even talking if you
because you're also taking into consideration breast density. If most women who have been told they have dense breasts look at their mammogram report, at the bottom of the report it'll say that they cannot be held responsible for a false negative, because dense breast does impact on the ability to see that hard component.
When we get into the second half of the program, I want to talk to you a little bit about, the step-by-steps, what happens and why. But also, here's another question. You do the traditional medical standard of care, which is, women need to go out. And by the way, over the years, and as you know this, women were told, starting about age 40, they should have a mammogram every year. And then that got switched out to 50. And then they said, well, unless you have a family background of it, you have one, maybe you don't have to have another one for a while. The problem and the reason that they were finding is things that we've been talking about for years, is that the procedure of mammography is deleterious. It's damaging to the body. You have 45 pounds of pressure crushing the breast.
Actually 50.
50. Okay, so 50, and now you have radiation going into the soft, delicate tissue.
So that cumulative radiation oftentimes is the cause of the breast cancer, especially for those women who have HER or HR positive, have the BRCA2 that can be turned on by the radiation.
Mm-hmm. You know, people are saying right now, oh my God, really? I've had, and the truth of it
20, 30, 40
tons of them,
mammograms.
right? And they end up with many invasive types of cancers because it's affecting the entire soft tissue.
Sure.
And it's damaging. And we know that radiation is a major triggering cause of cancer within the body, anywhere in the body. But now you have it focalized. That's right, in any amount.
Right.
And it actually increases the risk. After you've had a few, it increases the risk of forming cancer by 40 to 60%. Mm-hmm. That's huge. That's incredible. So let's talk a little bit more about, why thermography should be an initial look at opposed to doing thermographic or mammography. In your opinion, why?
Well, I mean, FDA will tell you this is an adjunct to an annual mammogram. Now, most of my patients, they use thermography as the initial because they want to see if there's anything from a vascular standpoint that it could be a problem before they go in for their annual. After a while, as you mentioned before, a lot of the women who don't have a family history or who have other medical conditions like autoimmune or have had cancer before don't want to continually expose themselves to cumulative radiation, so they'll do it every other year or every 5 years. Unfortunately, there's some women who avoid it altogether. So rather than avoiding breast health, awareness, they come in to do the thermography. In Europe and most of the world, thermography is the first step. Now, I'm not opposed to mammography. I am opposed to mammography being used as the screening tool because of the risk factor. So, if you have a suspicious thermography, the first thing my doctors are going to tell you is get confirmatory testing done. Do the sonogram, do the MRI, do the mammogram to confirm what we're seeing on thermography before you do anything. Because your oncologist and your breast surgeons are going to, tell you, do this to do this. I mean, the range is pretty scary as far as how to handle breast cancer these days.
And there's so much. Again, this is, Dr. Tom Roselle telling you that before you agree to anything, make sure you do your homework. There's so much available in today's world. They're doing things in Europe that they're not doing in this country. There's doing things overseas in different parts of the planet that are extremely effective. Don't be a sheep. But we're talking about something today that is extremely diagnostic.
Yeah, and just make educated decisions. Unfortunately, I get a lot of women who come in and they're almost apologetic. I don't know that my doctor is going to approve this, or I don't know if she'll let me do this. And I just kind of look and say, excuse me, your doctor's going to let you do this? You should have a choice as to how you want to monitor your breast health or your overall health.
Your doctor's not your parent or your guardian.
No,
and you'd need to know more than your doctor does to protect yourself.
But unfortunately, you have a lot of doctors who will belittle their patients because they're not doing the standard of care or what they feel needs to be done. Now, there are a lot of doctors out there that respectfully, I go to them for their expertise. But if in my gut I feel this is not right for me or not, there has to be something else, it's incumbent on me to go out and find out what else is out there.
Now, just for clarification, because we've been talking about our opinions on thermography and the experience that you've had over, more than a decade.
Yeah, I got a lot of opinions.
You have a few. But here's the situation. Just for clarification and full disclosure, you are a thermographic imager. You're taking the pictures. You're advising women, relative to what can be done initiated through thermography, but you don't read them.
No, I do not. I do not have an MD or a DC or anything else after my name. I tell every one of my patients, even though I've been doing this for 10 plus years, I know what I see because it's just experience based, but I always defer to my MDs who I transfer the images and the patient history to, and they do the assessment. But it's like anything else. They are not diagnosing whether or not you have breast cancer or not. They are looking at the images like a radiologist looks at an x-ray or any other type of diagnostic, and they are making an assessment for the primary doctor to act on.
Keep that thought, Derreth. We're coming up to a break. We're talking about thermographic imaging and why it should be your first choice as a screening modality. Derreth Painter, my guest in studio, your host this Wednesday evening, October the 2nd, at the Roselle Center for Healing in Fairfax, 7 p.m. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM WMAL.
Welcome back. You're listening to Dr. Tom Roselle Live. We are in studio, and my guest, your host, your presenter this Wednesday evening, October the 2nd, Derreth Painter. She's a 10-year experienced thermographic imager, and we're talking about thermography as it relates to breast cancer and actually extrapolating it to other types of conditions throughout the body. So it's important. Ladies, this program obviously is for you, but it's also guys. Guys are getting breast cancer today. And,
Absolutely.
Years ago, it was almost unheard of. But in today's world, we're talking, depending on the author that you look at, anywhere from 3 to 5% of all breast cancers are male. Derreth, let's talk about that just for a second. And why are you seeing so many men today with breast cancer?
A lot of it has to do with the xenoestrogens that are in our environment now. We talk about it in the office all the time. People are unaware that, the things that we have day to day in our lives hold a lot of these xenoestrogens, water bottles. And you can talk about how, you have to be really careful with these water bottles in extreme heat or extreme cold. Those bottles leach estrogen into the water that you are then drinking, and you're thinking you're doing a good thing for yourself, which is great. Drink more water. Trust me, Dr. Roselle will tell you that I am the worst at drinking water.
Yeah, we're going to IV you one of these days.
I know. But the fact of the matter is you do have to make sure when you put that water bottle in your car, don't leave it in there while you go into the office or you go in to go shopping or anything else, because you're allowing those estrogens to leach into the water that you are then going to be ingesting. You look at these Chemlon types, and I'm sorry I'm using a branding name, but when you look at all these luscious green lawns that you've got in your neighborhood, those are all estrogen-based chemicals that then leach into the soil, into the water system. My sister works for a water reclamation company down in North Carolina, and she'll tell you there are certain things that they cannot filter out completely out of the water system in those areas.
Here's, Washington, D.C. By the way, folks, we are in a water reclamation area in Washington, the metropolitan Washington area. What that means is your sewage water, your toilet water is being reclaimed, reprocessed, and put back in as part of the drinking water.
Right.
Now, if a woman or a guy is on any kind of hormone, that hormone can't be completely eliminated, and it goes into the water system, and now your body absorbs that. So that's another source of estrogenic impact.
Yeah, you've got estrogens and psychotropic drugs, which is not pleasant to think about.
Well, here's the other piece, too. In our world of pads and devices and all kinds of things, the radiation, the low-volt electromagnetic fields coming off of these things are estrogenic tags.
Sure.
And that causes a problem as well.
Yeah, of course.
Think about all the people that put their cell phones, guys particularly, in their pockets.
Their shirt pocket. Or
not okay.
As you hammered years ago, you saw these women with this bra. I never saw it, but these bras that had an actual pocket to put your cell phone in.
The cancers were horrible.
And they were. And we would, in thermography, we would actually see the shape of that cell phone in the imaging. And it was like ridiculous. You were bombarding the soft tissue with radiation constantly. So yeah, our environment has become one where you expose your body to a lot more than you really should or need to. You've got areas now which are going 5G, and I know there's a lot of, controversy about that.
Huge.
Where people are getting sick and their cancer rates are going up, their disease, rates are going up. So yeah, we're seeing more and more. I mean, unfortunately, in my patient base, I am seeing more men with breast cancer, which is, shocking. And I'm seeing younger women with breast cancer, which is another advantage to thermography, is you've got women who typically will not go and do a mammogram because they're 40, they're not 40-ish, and they can't get a good read because at 20, your breast density is much more significant than when you're 50 or 60, and, you go from a good solid 34C to a 32 long. But sorry. But the density issue is significant. So with thermography, we don't have to worry about the density. We just look at the metabolic changes and the blood flow aspect.
I just want to make a note. If I had made that comment, I would have been in real trouble.
I know, but I'm a woman, and I can tell you many of us
just saying,
we mourn that process as we go through. So I'm not saying anything that a lot of the women out there haven't said in their own brain. So I apologize if I offended anybody.
My guest in studio, your host, is coming Wednesday evening, October the 2nd, 7 p.m. at the Roselle Center for Healing in Fairfax. Derreth Painter, registered thermographer, and she is going to talk to you about why thermographic imaging should be considered as your first choice in diagnostics, backed up by other things when necessary. And this Wednesday evening, she's going to walk you through that. She's going to talk to you about it. She's going to really take the veil off of this thing and give you the pros and cons. So, give us a call at 703-698-7117. Register or simply go online at rosellecare.com. That's rosellecare.com. And register, push the button, and we will be back in just a moment.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. We have a very fascinating program today, one that's probably going to get your attention very quickly, because we're talking about a technique, a tool, a procedure that can often detect breast cancers and other types of conditions in the body much faster than traditional interventional mammography. In studio, Derreth Painter, a registered thermographer with a whole lot of years' experience. She is the head of Thermography Centers of Fairfax, which is, part of the Roselle Center for Healing. And subsequently, we've had the ability, the pleasure to use this technology with many of our patients over a period of many years with extreme positive results. As we said earlier in the program, thermographic imaging can detect the presence of the angiogenesis, the formation of the blood supply to a tumor, up to 5 to 8 years prior to the tumor formation. And that's significant. Derreth, welcome back. Let's get into this a little bit more specifically and kind of recap this whole process of thermographic application and why it's so safe, number one,
right,
and its applications and why people, women and men, as we said earlier in the program, because guys are showing up with more breast cancers today than ever before.
Right.
Why is this something that they should consider as a screening modality?
First and foremost, it's safe. There are no side effects whatsoever with thermography. We're essentially taking a camera, a specialized camera, that is taking images of your own body's infrared heat. Simple, straightforward. There's no radiation. There's no, in the application of breast thermography, there's no compression of 50 pounds on the breast tissue, so you don't run the risk that, God forbid, you do have a tumor, that you press on that with 50 pounds to spread that any farther than where it's encapsulated. And, the radiation, the cumulative radiation, isn't present in this process. The other benefits you're going to find is there's no age limitation. There's no, and we didn't even bring this up either, is for women who have implants. That's not an issue either, because now we're not going to worry about the integrity of rupturing.
The rupturing.
Yeah,
of
because
the
unfortunately I've had a couple patients who have had they've gone
and particularly the silicone.
Yep, they've gone to their mammography, and they've told them, I'm having some problems and I'm really worried, and then they find out that the mammography, the pressure has actually ruptured the silicone into the system. So that does present a problem.
It's incredible. I mean, we set, my opinion, as you know, the medical establishment, particularly in the United States, has set itself up for its own perpetuation of conditions and diseases. This is an example, as far as I'm concerned. Mammographies often are necessary.
Yes.
But they're not necessary as a screening tool. And as a screening tool, they can make things much worse. And we talked about earlier in the program that years ago when they first came out with the technology, said women should have this beginning at age 40, have it on an annual basis, minimally every 2 years, and then they switch it to 50.
Yes.
And then they said only if you have a family history, with genetic markers that are present, that you may want to consider it earlier on. However, what we're seeing is this huge increase in cancers,
yes,
and breast cancers and many other type of cancers, in both male and female. So here's a situation where we're talking about a technology that doesn't add to the risk level,
right,
but has a tremendous false a tremendous identifying capacity, opposed to false negatives and false positives, right, that are heavily into the mammography area.
Right. And the problem is this, you've got this technique that is the gold standard. But, it's funny, when mammography first came on, the horizon, it was not touted as the gold standard. It went through the same process that thermography is going through right now. Thermography, unfortunately, is going through it. It's slower than mammography did. But, the problem I have with mammography being the gold standard is we've done such a great job of advertising or marketing breast health awareness. And in October, that's Breast, Health Awareness Month. You say pink ribbons. Everybody knows what that means. Susan G. Komen races. Everybody knows what that means. You go to your gynecologist. Every year, that first thing they're going to do is they're going to tell you, you have to get your mammography. We've done such a great job of
indoctrinating.
Exactly. And you would think with all of that over the years, and I go back to 1982 when I started, that's when my doctors were telling me, you need to start thinking about going and getting this done. You would think that breast cancer rates would
drop.
Exactly. But what has it done?
Increased.
Exactly. Because you have to look at the research that is out there now that says cumulative radiation actually turns on the gene on a lot of these women who have BRCA2, they have HR positive, and you've got that cumulative radiation that actually just initiates that process. I've got women, unfortunately, who are avoiding the mammogram at all cost. That's
not good either.
No. I can tell you that I have had at least a half a dozen of women who have come into me because there's another option, but they weren't aware of it prior to, and they come and they said, I've had this lump for X amount of time. And doc, I've referred them over to you and to other doctors outside of our practice. The cancer is literally eating through their skin. And I don't even have to do a thermography. I already know that
it's denial. It's the ostrich effect.
Of course. So, I want to make sure women are aware that there is something else that is not invasive. It's not scary. It's not painful. And, it's an easy process. You come into my room and we sit there and do a history. We talk about, your family background. We talk about, do you have fibrocystic? Have you had biopsies? We go through a pretty thorough history of your breast health. After that, I have you take everything off from the waist up, put your hands on your hips so that we can cool down the axillary armpit area so that I can get images of your lymph nodes as well. And I take approximately 5 images of all surface areas, profile, front, back. I never touch you unless I have to palpate a visible lump so that I can mark it for the doctor. And I just simply take images, and it's done. It takes me longer to explain the process than it actually does to take it. And then I send it to the doctor, the MD, who evaluates it, writes a full report, sends the images back, and I give you, I send you the report. And then you and your doctor make the determination as to what next steps are. Now, we were talking about this earlier. I went through the process. I was doing all the thermographies for everybody else, and I forgot about doing myself. And I had someone take the images for me and came up with a lesion that I was unaware of. And we talked about this. Did. And I was like, oh my God, this is not what I need in my life. But anyway, I went ahead after doing some proactive measures. I decided that it was smart of me to go ahead and avail myself of all the things out there to make sure that, in fact, I did not have breast cancer because, as you know, Doc, I had a cancerous pregnancy years earlier, and so that propensity of having cancer come back is a pretty scary thought. So I went to go do my doctor and I had talked, my gynecologist and I had talked, and we decided let's do a sonogram first. And if that comes up positive, then we'll do the mammogram to limit my exposure to radiation. So I went over across the street, unbeknownst to you and all the other doctors in the practice, and I went in, and literally I was taken in and out of the room 4 times because they kept telling me you need to do a mammogram. I said, yeah, well, not today. This script right here says sonogram.
And that was from your gynecologist?
That my gynecologist wrote sonogram, and they refused to do it. And I said, ladies, we're bordering on insurance fraud right now because this script says sonogram, not mammogram. And they got irritated with me, of course. Didn't tell them what I did because I wanted to see what the average woman goes through when they ask to do certain things in obviously outside of the order. And so I got the sonogram, but the radiologist was so incensed with me. She only did one side. She was supposed to do the other, and she refused to sign the report.
It's because she's got a mammography machine that's what she uses. That's her standard of care. It's like going to a surgeon, and a surgeon has a knife, and what he does is looks the cut.
Yeah, a lot of them, not all of them, but yes. But the thing of it was, I had to fight to get the sonogram. And so, the sonogram showed we did the measurements, everything else. We monitored it. We continued with the care that I had chosen. And then I went back about, 3 months later and had the mammogram done again. It was not there. So they said, oh, let's do a sonogram. I'm like, really? Really? Well, now we're going to do a sonogram?
Well, the standard of care in the medical world is mammography, then sonogram, then MRI. Right. And it actually should be reversed.
Exactly.
You should be, mammography should be the last piece. Go in, see if there's something there. Do the sonogram first. With thermography, if you have increased risk because the thermal imprint is there, which is suggesting that there's an increased blood supply, which is...
And it's suspicious. It could be hormonally based, it could be fibrocystic, but it also could be pathological.
Sure. And then if you run, you do a sonogram, and then even do your cancer markers, your breast cancer markers, CA15s and 125 and so forth. Now, if you have something, and that can be done in a very short period of time, you're not wasting any time. And then if you have to, you go to the next step.
Exactly.
But unfortunately, the way it's set up, my opinion, is that we're dealing with it's big business.
Yeah. Well, so that was 5-6 years ago that I went through that process. Right. So now I've been told by many of my patients, you don't have the option of getting a sonogram. They will literally refuse care to you, even if your doctor writes a script.
Yeah, they refuse.
They refuse. They will turn you away. You have to have mammogram first, and it has to look as if you have, they can't diagnose, but it has to look as if you have cancer before they'll even consider a sonogram.
And we said that the false positive negative rates are up to 20% with mammography, which says, really? You're missing all kinds of things.
But they can't think this is how it is and this is what's going to happen. Now, the other piece of it, and I'm not sure you're aware of this, but I'm sure it'll it'll cause a comment. You don't have to have a script from your doctor to get your annual mammogram. As a matter of fact, the radiological offices can cold call you. They can get a list.
They can solicit you.
Yeah.
So we're talking
So
straight up
they don't
solicitation.
need to know. They do
I want to
not.
sell you a thermographic imaging.
Exactly. So
Not thermographic, mammography.
Yes.
I want you to come in and we're going
yes,
to crush.
you're due for your annual. Let's go ahead and schedule that for you. They don't even have to know who your OBGYN is. They don't need to know who your primary is. They can call you and solicit you just like any other business.
There's something wrong.
Well, I just thought I'd put that out there.
Yeah,
So,
there's
anyway.
something wrong. I mean,
So-
when you put it in that context and you realize the increase in cancer rates, you realize that they're missing them globally.
Right. So what I'm telling you is, I'm not opposed to all of the things that are available to a woman. I think that the screening tool would be better served if it was thermography first, and then sonogram, and then mammogram, MRI. However you and your doctor choose it to be. We're finding that women don't have that choice anymore.
What happened to the personal, relationship between a woman or a guy and their doctors, and they decide together,
Yes.
as we're advertised all
Yes.
over television, what the best step is for them?
Right. And unfortunately, it's what the doctors are being fed by a lot of the reps that come in. I do have a lot of docs that are very open-minded and very supportive of their patients. There are two this last week that sent me patients because they said, I really am uncomfortable doing the mammogram. And I said, have you considered thermography? Why don't you do that? But they've been educated as to what it is and what it isn't. Thermography has limitations, just like mammograms have limitations. It's great to have all those different information available to you so that you and your doctor can make the right decision for you.
It's important. As everybody knows, my first book, Ageless Health, Health is a Do-It-Yourself program, was really written for my patients. And I did that because I want them to be educated. I want people that come to us for all kinds of things to really know what their options are.
Sure.
And what can be done and to support that system. Here is one of those things. Digital infrared thermography is far safer and not time wasting, if you will.
Sure.
But it can give you a piece of the puzzle that you wouldn't have known about or seen prior to having it done. It's important. This Wednesday evening, October the 2nd, at Roselle Center for Healing in Fairfax, Derreth Painter, registered thermographer, been in the business for over a decade, is going to give you the why and wherefore and how come and what to do next based on this. And she's going to show you both sides of the practice. And she'll show you some images before and after what happens and why thermography is such a powerful tool in being able to detect breast cancers. This is an opportunity. Go online and register today, RoselleCare.com. That's RoselleCare.com, RoselleCare.com, or simply call 703-698-7117. That's 703-698-7117. Register so we can prepare for you. I promise you, this will be an evening that will open your eyes and give you another tool to protect your health and perhaps save your life. We'll be right back after these messages.
Dr. Tom Roselle Live continues now on WMAL.
Welcome back, everybody. You listen to Dr. Tom Roselle Live. And for the next several more weeks, we are still on Saturday afternoons at 4 p.m., from 4 to 5 p.m. So make sure you tell everybody that until Redskins season's over, we're going to be on Saturdays, and we'll negotiate after that. But we really appreciate, that you sending out the message, the word, so to speak. My guest in studio, Derreth Painter. She's a registered thermographer, and she will be your host, your presenter, this Wednesday evening, October the 2nd, at the Roselle Center for Healing. Look, we're talking about breast cancers and why thermographic imaging, digital thermographic imaging, is far safer as an initial screening process to detect all kinds of problems that can occur in breast tissue. And guys, we said earlier that 3 to 5% of all breast cancers are male today, and it's growing simply because breast cancer is now environmental in its triggering mechanisms. And we've touched upon a lot of things, but this Wednesday evening, you're going to get an insight that is going to be very significant. It's going to give you data that you can really go back, and in many situations, you're going to know more data, more information than many of your physicians will. So join us and give us a call, register, make it happen. Derreth, we touched on a lot of different things. I know you're going to get much more in depth this Wednesday evening.
Yep.
What are you going to cover? Why should people show up this Wednesday?
We're going to look at the myths of thermography, what it is, what it isn't. We're going to show some images so people understand what it is they're looking at, so that way they can make an educated decision as to what are the best options for them in their overall health assessment. Obviously, mostly women, but my goal is to make sure that women don't avoid breast health awareness or breast health, because I'm seeing more and more women who are avoiding going through the process of the typical mammogram, and then they're coming to me, as the last option, or because a friend told them, hey, take a look at this, and then, their cancers are already set and just taking over.
You can take a look at it. We said earlier, there's so many people, unfortunately, that are in denial.
They're fearful.
Sure they are.
Yeah.
But when you have a cancer that's starting to create this cauliflower bump, or it's broken through the skin tissue, or it looks like a speckled something, those are all indicators that cancer has already metastasized and is going throughout the system. This is an opportunity to find out if there's a blood supply that's going to produce a tumor formation or an inflammatory pattern well in advance. Derreth, distinguish, we only have a couple minutes, but I want you to distinguish, if you will, the difference and the effectiveness of thermography relative to an inflammatory cancer opposed to a ductal carcinoma.
So when we look at that, or when my doctors look at that, they're looking at an image of inflammation where it shouldn't be. Obviously, they're looking at asymmetries within both breasts. If there's something that comes up that looks suspicious in nature, they look for almost like a spiderweb effect of that angiogenesis that's kind of taking over. And when you come in to do a breast imagery, we're going to take an initial image of what you have in that moment in time, and then I have you come back within 90 days to do it again. And the reason for that is we want to establish a fingerprint, if you will, a baseline. But cancer cells typically duplicate every 30 to 90 days.
That quickly?
Yes. So duplicate just doesn't mean that it's going to, it just means those cells duplicate. So we want to look at that window of 90 days to make sure you're not in the middle of that angiogenesis process. And if you're not, if we have two stable images 90 days apart, that's your thermographic fingerprint. If there is some shift or change, or that inflammatory process is getting larger and more profuse, then we have to sit there and say, you need to have, other sources to confirm what we're seeing. And then we're going to monitor you another 90 days out and another 90 days out. So until we find out what it is that you have, confirm or deny that this is a pathological process. But you're able to visualize what's going on in the body, which is a key.
Well, this Wednesday evening, Derreth is going to present a program that is going to be not only fascinating, but it's going to give you tools. It's non-invasive. There's no radiation. It's painless. It's an FDA-approved procedure. Join us this Wednesday evening. All you have to do is go to rosellecare.com and register online, or give the office a call at 703-698-7117. Derreth is a registered thermographer. She's been in the business for over a decade. She has an intuitive sense to her that is second to none. Join us. We'd love to have you there. And remember, we do these programs for you so you have the knowledge, the ability, and the application. We'll see you there. We'll see you next week.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.